So with my job, I see the nice side of people.
When you get a dog, research, speak to your vets, ask questions.
I would rather have a client who's paranoid than a client who's negligent.
Do private vets encourage spay neuter?
I will practice my profession conscientiously with dignity.
Walking needs to start because of the amount of senior dogs I'm seeing being abandoned because of health conditions.
I literally saw my son go through all the stages of grief. Pets are like siblings.
Hi, Scotty, what's my give him a biscuit,
Won't you
dog.
come and have a biscuit? I love the face. Look at
Reject
that.
goat.
Even if you don't have a pet, try and inculcate certain values in your kids, for example.
If someone doesn't have a home but is bringing their puppy to a vet is commendable.
The day I got married, I walked Paddington. The day I went in to have my son, I walked him half an hour before going into hospital. The day my father died, I walked the dog. I still wouldn't change it for anything.
I don't know how I would have survived with Watsy with all his health conditions if you didn't pick up my call.
When people have to buy a phone, how much research, and they'll ask and they look, but buying a dog or adopting a dog, it's such a spontaneous, impulsive decision.
Hi, welcome to 4 Legs, 2 Mics. I'm Shivani Mathur. Today on the podcast, we have someone very dear to me. She's probably number one on my speed dial for over a decade. My doggie's vet. She's a doggy GP, a veterinary physician. Her name is Dr. Nicole Rego. She's been working with Happy Tales Mumbai for 20 years plus, and I can't wait for you all to meet this wonderful vet. Hi, Doc. Welcome to 4 Legs and 2 Mics.
Hi,
Thank you for agreeing to come.
Thank you for having me.
Yes. Doc, what do you love most about your job?
I think my job is one of the few jobs where it gives you're happy to get out of bed in the morning. I think that's,
Yeah.
And being able to help the voiceless. I think also with my job, I see the nice side of people. You know what I mean?
All sides, no? But more
All
nice.
sides, but more
Yeah.
nice than otherwise.
That's nice. That's really nice.
I'm blessed. I am blessed.
But you are a blessing. As a vet to all of us, we're really blessed with
You're
you.
darling to say that. I don't know, but
Yes, you are.
It's wonderful, yeah. To meet
nice.
to meet these every day. It's just it does something to one. You can't. It lifts your mood. No, I think especially during the pandemic, so many people went out and got animals or adopted animals because they
realized.
You combat loneliness. Owning a pet or having a pet it gives you a reason to get up and get out. There's so many people I know who are battling depression or anxiety or other things, and just having an animal of their own is
But I also feel, Doc, that line is very thin because you should get a dog for the dog, not for what you need.
No, I don't mean they do it for themselves.
Yeah.
But what I
it's a
mean is
good
that
thing.
dog. So say you're battling depression and it's all you can do to get out of bed in the morning. If you have to take your dog for a walk, you have to get up. You have to get out.
Yeah, that's
or
true.
I have a couple of clients who've confided in me, where their children have been bullied at school or targeted at school or whatever. Just being able to come home to a dog who loves them and understands them and gets them, where they don't have to put on an act, because very often these are kids who are going through puberty. So even with their parents, they're
rebellious.
Not necessarily rebellious, but they don't really confide as much as they should have. The parent knows they're having a tough time.
Yeah.
The fact that dog is there for them, it means the world to them. It's just it's a game changer. And I think for kids especially to grow up with an animal, and for me personally it happened. You become more compassionate.
100%.
It teaches you to be more responsible, and you just, I've seen with my son, because he grew up with 2 cats and a dog. And it's just, sometimes even if he's in a bad mood and then the cat comes next to him, and then the whole, the expression just softens.
Yeah, it's amazing. Do a lot of kids come with their pets to the clinic?
A lot of kids come with their pets. They ask questions. I've had a few who are very responsible. They come with lists, and of course now the lists are not written, they're on phones, but still it's a list. But I love
list of questions?
A list of questions.
Oh,
or what today somebody came in with first time pet parents with their 2 daughters and the dog, and they were asking questions and figuring out how they need to hold the puppy and what they need to do.
Fantastic.
So I really think and what I do is, even if parents don't realize that the child can take on some of the responsibilities of caring for the dog or cat, I tell them, I suggest it to them, and I give my own example.
Yeah.
And there's nothing, it's not, so the child should not just look at the pet as a plaything.
Yeah.
It's part of the family now.
Yeah.
And so, for example, I know a lot of children who are very happy to brush the dog's teeth, not as happy to brush their own teeth.
Really? And that's a task, huh?
Exactly. But like I said, if you start as you mean to go on, and you put it into practice from the time the dog's a puppy, and you put your 7-year-old or 8-year-old in charge of it, then nothing like it, no?
Yeah.
No?
Look at these two puppies. Dog.
This one needs to be brushed.
Yeah. That's so cute. So kids, do pet parents come and ask you at what age they should get a dog with a child at home?
So I find that, unfortunately, in India especially, I don't know how, I can't speak for the rest of the world, people tend to get a dog when the child has finished their 10th or 12th, which is ridiculous, because now the child is going off to college. The child has a social life. The child has so many commitments that the dog or cat is no longer the child's pet. It's basically the parents' responsibility.
Yeah.
I think the perfect age is when the child is 7 or 8, because now they're old enough
8
to
plus
take on
usually.
some of the responsibility, and they grow up with the animal.
Yeah.
And it happened with me, it happened with my son. It's wonderful. It really is wonderful. It can be hard when they lose the pet later on, because now these are like in so many houses, including my own. I have just one child, so the pets are like siblings. So it can be hard, but I think that I am so happy that I grew up in a household with animals. I'm so happy that my son has grown up in a household with animals. I wouldn't change that. Yes, it's a responsibility. Yes,
it's a lot of
it's a lot of responsibility. The day I got married, I walked Paddington. The day I went in to have my son, I walked him half an hour before going into hospital. The day my father died, I walked the dog. I mean, but I still wouldn't change it for anything. I think it's...
And I think I've been there in your life through all of those phases. I remember when I met you, you were dating Danish. I remember the day of your wedding, because of course, Watsy was at the clinic for whatever reason. And I'm like, where's Nicole?
Fortunately, I wasn't there. I worked it 3 days before.
But I was like, where is Nicole? And Dr. Karkare looked at me and he's like, she's getting married today, Shivani. I looked at Watson and said, Watson, you have to give us a break this evening. Do not come back today. We are all going to be shutting the clinic at 1 o'clock for Nicole's wedding. Then I remember when you were pregnant and you took leave, and then when you had your son. I think I've been there with you through it all. Yeah,
my son's 10 now.
So cute. Tell us a bit about yourself. Why did you decide to become a vet?
So when I was born, we already had 2 dogs. My father was a big animal lover. So growing up, I always had animals. I had squirrels, I had birds. And then when I was 11, I was given a Dalmatian for my birthday, and my parents made it very clear that this was going to be my dog. So I was responsible for cleaning up after her. I was responsible. I don't think anybody in that house ever bathed her except for me. I took her to the vet, Dr. Karkare, who I work with. And but another thing that cemented my decision to be a vet was when I was 8 years old, my parents got me all 6 of the James Herriot books. I don't know if you've read them. It's All Things Bright and Beautiful, or Creatures Great and Small. So it's about a vet who's based in Yorkshire, and he's mainly a farm animal vet. But I had decided to become, I told my mom I would become a veterinarian when I was 4 years old. But when I was 8, I think that sort of cemented my decision, that book.
Sweet. What is the Dalmatian's name?
Daisy. She was Princess Daisy. But she came to us named.
Okay.
She came to us named. No, we got her from a family in Bandra. And in fact, that lady now brings her dogs to me so many years later. But Daisy was a darling. She was a very girly dog. Very well behaved.
And how long have you been practicing as a vet?
So I officially now 20 years. But
Longer.
Yes. So the clinic where I work, I joined as a student. So I was just telling you earlier, I think it's 22 years now,
wow,
23 years,
So are you all trained in how to handle animals?
I think we've sort of learned on the job, and we've watched or learned from behaviorist videos or lectures or series, and we try to train our staff also to handle them appropriately. So for example, for cats, in college, everybody used to just, scruff the cat and hold the legs and down. They were down. And now we very rarely end up having to even scruff a cat. We usually use a towel.
Okay.
And you would take, those big Turkish bath towels and you wrap them. You're supposed to make them like a burrito.
Yeah.
I try as far as possible. So with cats, I try as far as possible to take them into a room. I don't like to see them out where there are a lot of other people. So it's quieter. I try not to make too much. So if you're talking to the client or to whoever's brought them in, or even to your staff, you try to make as little noise as possible. You don't talk loudly. You try to let your voice be at a certain tone, at a certain decibel level. You handle them also a certain way. With difficult dogs, we sometimes try to use cones or through the e-collar.
Yeah.
If it's a particularly difficult dog where we think we're going to have difficulty even picking them up. So when we pick them up, even with dogs, the boys at our clinic are fantastic. So they've learned how to pick them up with the towel. So it's really good. So they take 2 towels and they go from the back. So if somebody is just holding the leash, not like when you're using a catch pole, just holding the leash, but yes, holding it slightly taut so they're in place. They're not being choked in any way. And then their 2 boys approach, and while I'm probably standing in front and distracting the dog, then somebody goes from the back, reaches down and holds, and then they put them up. But now you have drugs you can use to help. So, for example, I understand if it's a stray that's being brought in, it's harder. But there are drugs like trazodone and gabapentin. So, day before yesterday, in fact, somebody brought in a very, very anxious, nervous dog. We entered the clinic, but we couldn't do anything else. And it was a routine wellness check. Yeah. So I needed his shots. So I had her go home and medicate him, and she came back. So she did trazodone and gabapentin. They have this chill protocol that vets can use. And he was a different dog. I mean, I'm not saying he was happy to see me, but at least we were able to get him on the clinic, onto the table. I was able, and see, it's not just when you vaccinate, you're not just vaccinating. You need to do a physical exam. There may be little lumps and bumps that have come up that need to be investigated, into auscultation. I was able to do all that, which made me very, very happy. So the chill protocol for dogs, toweling, e-collars. It's called the chill protocol. Then there's e-collars, the Elizabethan collars. So I also try and get clients, if they have dogs who will need to be muzzled, to muzzle train at home. So you use a basket muzzle to put their treats in, to put their food in, and you slowly start with that.
Nice. So you tell pet parents.
I tell pet parents that. I also, if they have behaviorists and the dog is anxious or nervous in the clinic, despite them consulting a behaviorist, quite a few of my clients have brought the behaviorist. So one of their sessions then is in the clinic. So the behaviorist sees how the animal is reacting to being in the clinic environment, and we're able to work around it. And it also, see, a lot of dogs, like how children are better behaved with their teachers, a lot of dogs are better behaved when their behaviorists are around. So what I find is that the dog is also calmer, and we're able to do more, and it just helps because now the behaviorist can see what the pet parent is talking about.
And they can work
and
on
they
it.
work on it. I also tell, so when people come in for like a first puppy consult or a first kitten consult, I always tell them that right from the beginning, I want you to I want them to get used to being handled. I want you to touch the paws. I want you to look in the ears. I want you to open the mouth. I want you to be able to help your animal should you need to. I also teach them that more than sit and give paw and roll, there are commands like stay or come. Recall is important. Drop if they've picked up something they shouldn't, something that's toxic or dangerous. You should be able to get it out of their mouth.
So you remember?
That's
what's the TV reports? Batteries.
Exactly. So that's scary. And puppies will swallow anything that fits in their mouth. And then, in the whole excitement of chasing after them to get it out, that's when they swallow it. So, that's one thing. The other thing I do is I encourage clients who have nervous pets to do what I call nonsense visits. So you just come into the clinic. Like a happy visit. So you come into the clinic, you say hello to us. We don't put the dog or cat on the table.
They just come.
So that doesn't work for cats so well because cats do get stressed. But with dogs, you come in, you say hi to us, the dog walks onto the weighing scale, you see the weight, you say bye-bye, everybody pets the dog and they leave. So I feel like that also helps reduce their stress levels.
For sure.
So those are the...
So at Happy Tales, everyone, you encourage happy visits.
We encourage the happy visits. We encourage...
Nonsense visits.
Nonsense. I call them nonsense. Yeah, happy visits is nicer. I should start saying that.
No, nonsense
Happy
visits is
visits.
good.
Also, if you know you have an anxious animal, then you pick an appointment accordingly. You pick one for like first thing in the morning where they don't have to wait too
Yes.
long. If it's a dog like a flat-faced dog, or like Watsy, who you know it's going to get hot and at 11:30,
so not
12, sitting out in the sun, getting anxious because there are 10 other dogs waiting.
Yeah.
That's not
So
advisable.
that again comes down to responsible
Yes. So
pet
you
parent.
you take an appointment just first thing in the morning, or ask
Yeah.
the doctor, is there a time? Can I get a particular room so that it's quieter? So that's another thing that I do. If a cat, for sure, we always take a room. But even with first time
Pet parents. Yeah.
or for dogs who are particularly anxious, it's just nicer if they're in an environment where they can get used to the space rather than having somebody enter every 3 seconds.
Yeah.
That's stressful.
It's
So
very
I don't
stressful.
like that.
Vet visits are stressful.
Vet visits are stressful.
In general.
Yes,
So
I
but-
understand. I understand, but I feel like if we try and just with the environment, you
Yes.
know, with the sound of your voice, with the way
No,
people
it's
are
amazing, Doc. I
talking.
mean, if you're telling your clients that's
No,
amazing.
I do, and yeah, so I remember I attended a lecture given by a cat behaviorist, and she was saying that, you know, their sense of hearing is so acute.
Yeah.
So they showed a BBC video where somebody was cutting vegetables. So to us, if you're cutting a mushroom, it's barely audible.
Yeah.
But to a cat, it's loud. And then if
Really?
you're cutting a carrot, it's much, much louder. So she said, you know, even in the clinic, when you're when you're examining the cat, you know, try not to, for example, drop your forceps on the table. It makes, that sound is still loud. So place it gently. Try and tell the owner if the cat is really anxious, to the way you would soothe a baby in a sort of repetitive, not like a lullaby, but you know,
It's
you talk
similar.
in soft soothing and you keep repeating the same thing again and again. It helps. So I try and do that.
Yeah.
We are sometimes pressed for time and we do get stretched. So it is difficult. But I just feel like it's easier.
Yes.
And also your physical exam then is easier, because otherwise if their heart rate is, you know, if their hearts are racing and their temperature's all over the place and they're stressed and they're panting and they're drooling, and I don't want that.
Yeah.
I don't want
That's
that.
amazing, Doc. I mean, that's really good information. I didn't even know that about cats. That's amazing.
No, I've become a cat person.
Yeah,
And
yeah.
I've always loved animals, but cats, there's something
Really?
about cats. Oh yeah.
I've got one that's coming meowing around me over here in Bandra right now. Very sweet fellows.
So the Bandra cats are something else.
Yeah,
huh?
they're really quite cool, huh?
They're
All
very
well fed.
very well fed, very confident,
And very human friendly.
very, and
And
especially
this one walks alongside me
yes,
like a dog.
yes, they accompany you.
Yeah.
They talk to you.
Yeah.
So cats don't talk to each other, but they talk to humans.
They don't talk to each other?
No, apparently they don't.
Slap each other?
No, that they
Yeah,
do.
they do that ninja.
Yeah.
They do that ninja move, right? I've
So
seen them beating each other.
I lost my boy cat, my male cat
Oh.
recently, but
Sorry, dog.
it's very hard. But so he brought the girl. Okay, so my female cat, he was
brought his
neutered,
girlfriend.
but one day I found him sharing, because we're on the ground floor and my windows were not. We didn't have the meshing. So
Yeah.
one day this small little female cat, little more than a kitten, sharing his food. So anyway, I adopted them both. But you would think, but they didn't really hang out. So they would hang out together but separately.
Yeah.
So on either sides of the couch, either sides of the window. And if they came too close to each other, then they'd get a friendly whack. You
Yeah.
know, that's how
Slap
was
each
it.
other, no, they really
But
do.
after he passed, I noticed that she was very subdued.
Aw.
So she did grieve. You know, people say that cats are selfish and you know,
course
but
they
they're-
grieve,
oh,
dog.
she grieved. She definitely, now she started venturing out around the house again and coming and
How's she
talking
with the
to
dog?
us. She's fed up.
Yeah, who's better, the dog or the cat?
Cat.
The cat is
So,
better or the dog?
They came when I had Paddington.
Yeah.
And
Oh, the
Paddington-
cats came during Paddington?
My cat is 11.
Ah.
Paddington. So
I
they
remember.
came when Paddington was 7. This boy, and I was pregnant for both the cats.
Yeah.
So the Tom came in, and then this girl, and they loved him because, you know, Paddington was a lump.
Yeah,
He
yeah.
would just lie there.
Paddington,
He'd just lie there.
That was
And-
dog's Bassett, no?
Yes.
Yeah.
And they would sleep on top of him and curl up with him, and that was it. And then Paddington passed away, and in 2019, I offered to foster an indie.
Yeah.
And she's still with me.
Failed foster.
Yeah, failed, foster failed. So she's a doll.
What's her name, dog?
Her name, is Sooty, Sooty.
Sooty,
Because my son was young at the time and he was going through an Enid Blyton phase. And in Enid Blyton, all the black cats are called Sooty. And
the
she's a black dog.
Oh,
also
so
like
sweet.
Soot. Like,
Oh, yeah,
like from the
yeah,
chimney.
so cute.
So Sooty. But my, people think that we're mispronouncing Sweetie.
Yeah,
Or
yeah.
just Sweetie. very cute. Sooty. But so Sooty is, she doesn't hurt the cats and she loves the cats. But every time she sees the cats, and we have a very small house, she acts like she's never seen them before. So it's like, and then she go. And then, so my boy cat, he was a darling, Rafa.
Yeah.
He'd put up with her nonsense. So she'd nuzzle him and then she'd knead him like dough and he'd be on his back and then until he got fed up and then he'd finally whack her.
Yeah.
And then his claw would invariably, his nail would get stuck in her collar and then she'd be going like this, but that was fine. But my girl, Kafrial, her name is Kafrial, like the masala.
Oh wow.
So she it's like Garba. So she smacks the dog and the dog takes 2 steps back and then Kafrial will take 1 step forward. And then the dog will come again and she'll give her 1 whack. So for her to get from room to room.
I'm featuring your animals doing that.
But it's really, I swear, I kid you not, and it's every day. But if the cats are on furniture or in the window, then she leaves them alone. Then the dog and the cat will chill together. But if they're on the floor, she thinks they're fair game. So then I should film it and send it to you. I promise
you have to dog. I have to see this Garba dance in your
It's like Garba. And it's literally 1 whack, 2 steps back, 1 step forward, 1 whack, 2 steps
back. I remember once you told me you left her and then you came home and the whole curtain rod was down.
The curtain rod was down.
Because your dog was climbing curtains.
My dog she's an Indie.
Yeah.
And Indies are wonderful. They're very intelligent. They're very loving. But they have a lot of anxiety issues. But I think that comes from...
That's genetic trauma and years of it. Generational trauma.
And in her case, what happened was I adopted her in 2019. I blame myself in a way because I didn't focus on her behavior as much as I should have. There was a lot going on. In between, my son was in hospital and I traveled and a lot happened. And then the pandemic happened.
Yes.
So because of the pandemic, she was never alone. There was always someone at home. Yeah. So with Paddington and the others, we'd go out to work and whatever. Here, everyone was home. So then when we actually started leaving her alone, even if it was for half an hour or 1 hour, she'd literally bring the house down. She broke the curtain. It looked like a stage, like a theatre, because the rod was like this, the curtains, and they were like a maroony curtain, were like this and down on the floor. And then to add insult to injury, she peed and pooped on the curtain. So, but
is she better now?
She's much better, but it just took time and patience. And I did consult. I consulted Raj Marigala, and she told me. But it takes a lot to put in that kind of time and effort.
Yes, it does.
But here now, finally, she's amazing. I can leave her alone for 6-7 hours now, and she's very
Nothing
good.
is destroyed at
Nothing is destroyed, but I would not risk leaving her alone anywhere else. Like I wouldn't even leave her at my mom's. My poor mother, we had to repair her front door. She made a hole in the front door, 40-year-old door. It was like she vented it like a woodpecker. So it was this much in 1 hour. Her whole paw fit through.
Oh my God.
She vented a 40-year-old door. The first time we left her alone. Yes, but
that
us too.
Yes.
Yeah. My mother was not pleased.
No.
So the first time we left her alone at my mom's.
Yeah.
We had to go out. It was a family thing. I came back in an hour. In that 1 hour, the damage, the havoc she wreaked.
My God.
We spent over 1 lakh repairing all the damage in 1 hour.
Oh my God.
Yeah, it wasn't a joke.
Great Indies.
I know. But
are you seeing more Indies being adopted in Bombay in the last 10 years?
100%.
That's great.
But I feel like people need to know what they're getting into, and I always insist. So every breed has their they have their really good points, and then they have their they may have stuff that like hip dysplasia or other things like health issues, and some of them do have behavioral issues. Beagles, I would not recommend a beagle to a first-time owner. They're very difficult.
Or a husky dog.
Or a husky, yes. So people don't realize that. And what Dr. Karkare always says is, he's like, when people have to buy a phone, how much research, and they'll ask and they'll look. But buying a dog or adopting a dog, it's such a spontaneous, impulsive decision.
And that goes into responsible dog ownership.
Exactly.
Right.
So you come in with an Indie puppy, I will give them all the good points, but I will also tell them to learn from my mistakes and my experience with my own Indie.
Yeah.
So don't let things slide. Don't take it for granted. Right from the beginning, start as you mean to go on. It's very important.
But I also feel, unfortunately for these poor Indies, it's this notion is put out that, adopt an Indie, it's such an easy dog. Needs shelter, needs food, which I feel is a very bad way of projecting
It's absolutely incorrect. And people tend to think that because they're Indies, they don't have health issues, which is rubbish. They're dogs at the end of the day.
Yeah.
They have the same problem any dog can have, whether it's you can have a Hindi with hip dysplasia, you can have an Indie with kidney disease, you can have so many of my Indies have EPI, which is exocrine pancreatic insufficiency, which is a disease you normally, a condition you normally associate with German Shepherds.
Really?
Or urinary incontinence.
Yeah.
Post-space. So many Indies of mine have that. So it's not that if you get an Indie, it's going to be a walk in the park.
Yeah.
It's
Any
like
animal,
having
right?
any child or any baby. It's the way it's going to be. So you have to put in that effort to know what you're in and do your homework. And once you get the puppy home, you have to, like I said, start as you mean to go on. You don't wait for them to form a bad habit and then try to correct
But
it.
unfortunately, I think that's what's been happening for the long. Though I feel it's getting better.
It is. But so I always tell people that it's become like new age parenting. It's it's about positive reinforcement.
Yes.
It's not about punishment and
alpha training
that
nonsense. No.
And it's about positive reinforcement and about preventing bad behavior rather than having to correct it.
Yes.
So for example, if you're going to leave your puppy for the first time in a room like this, you can't blame her if she brings the light down and chews up the wires or destroys your couch. You have to puppy proof your house. You can't, and then you train slowly. But people, I think they don't realize how much
it's a commitment.
It's a commitment. It's the same like having a child. No matter how many books you read, nothing prepares you for motherhood.
Nothing prepares you. Don't you remember watching on the things that one had to do? I usually tell people that before getting a dog, researching which dog suits your lifestyle, identify your vet, identify your trainer and behaviorist. These are things that need to be set before the dog comes in.
And it's not just lifestyle, it's even simple things like your flooring.
Yeah.
If you're going to get a golden retriever puppy and you have marble flooring and the dog's going to be slipping and sliding all over the place for the first 8 months of its life, it's going to exacerbate pre-existing dysplasia.
Yeah, let's talk about flooring dog for sure.
Yeah. So you need to, I mean, it's important. So what we normally recommend is for large breed puppies. So so slipping and sliding is not good for any breed.
Yes.
But especially for large breed dogs, for the first 8 to 10 months of their life, it's important that they don't slip too much. So what I tell people to do is the smallest room in your house, that's where you can put down yoga mats or something that's cheap, something that's washable, and something that's sort of durable.
Yeah.
And the dog should spend most of his or her time on that surface where they have some sort of traction.
Yeah, even the jumping dog on sofas up and down.
Yeah, it's not good. And even for little dogs. So people, people think it's cute to have them up there, but they don't realize the toll it's taking on their knees.
Yeah.
And little dogs do have patella issues.
Yeah.
So your Shih Tzus and your Maltese who are trying to jump onto the couch and not making the jump and falling down, and it looks so cute. It's not particularly good for their knees.
Yeah. Oh, that's amazing, dog. I mean,
or even when
put ramps. Remember?
Again, when you pick up, people tend to pick up their dogs. When you pick up babies, this is not good for their necks or their backs.
Yeah,
and especially as they get older and overweight, and then all that weight is being borne by this part. It's not good for them.
No, I think that's a very important thing. I remember Happy Tales gave us a lot of first pet parent stuff. So what all, you give the vaccination schedule, you give deworming.
It's not that, but we talk about flooring. We talk about not necessarily crate training, but about using a playpen or something. So at least it helps you to potty train. It also helps you to puppy proof your area. We talk about the diet. We talk about toys. So little things like, for example, people don't realize that ideally the toy should be bigger than the size of the head.
Yeah.
Because as you know, they will swallow anything that fits in their mouths.
Yep.
So that's one thing. Things about sponging, about bathing. Like in India, we have this thing about wanting to bathe the dog. You don't have to bathe as often as we do.
And bathe with human shampoos.
And you don't need to scrub. And you should always dilute your shampoo.
Yes, 1:5.
Yes, 1:5. And I always tell people, if they're bathing, that if you do intend to use a blow dryer, get your dog used to it beforehand.
Yes.
Because that's also stressful and
very
frightening. So you start, even on a regular day, you can run the blow dryer in another part of the room just so that they hear the sound.
Yes.
Use it on a cooler setting. So there's stuff about bathing. There's stuff about teething. So for the first 6 months, because people don't seem to realize it, that when they come to you, they have their milk teeth. So and they're also mouthing is a way for them to sort of explore their environment.
And they experience the world with their
Exactly.
mouth.
The same way children would pick stuff up and put it in their mouths.
Yeah.
So it's normal and natural for them to tease, but there's a way for you to deal with it. Don't also just give in and allow them to bite you, because that can also become a habit.
Yes.
Then. So you
Toys are different textures, dog.
different textures. You hand them something else.
Yeah.
So that sort of thing. And I also warn them. I say, look, your puppy's not going to get his or her rabies shot for another month and a half. If they
Yeah.
come at 2 months.
Yeah.
So definitely not for another month at least. So you need to then talk to your GP or pediatrician, whoever it is, in advance. Because if you get a nip, which you're bound to get, the
Yeah.
puppy's teething, it does not mean your puppy has rabies, but you need to know in advance whether your doctor feels like you all should get preventive. Because
Yeah.
there are some who I feel may be unnecessarily paranoid, but but you know how, but you would be surprised at the number of people who then I get pictures of wounds of the child's hand or somebody's foot.
For a scratch and rabies.
Exactly.
That's been for generations, doc. If even if a home dog or a dog, a community free roaming dog, scratches you and blood comes out, everyone runs for those rabies injections.
But I always tell them, look, it's technically we're not supposed to advise them, so it's always better to check. So why not just check in advance? If this happens, what do I do? Because invariably Murphy's law, if something happens, it's a Saturday night or a Sunday.
All the time.
Always. So it's bound to happen. So check in advance. Forewarned is forearmed.
No, fair enough.
So you know.
So now talking about weekends in Murphy's Law, how did you manage to? I remember you're probably the only person who would pick up my call at 12 o'clock at night, at 3 o'clock in the morning, 4 o'clock, 6 o'clock. If you didn't pick up, you text saying, I'll get back to you. I find that very unique, and I feel I was very lucky to have a vet like that.
That's very sweet.
Especially because of my little Murphy's Law four-legged dog, that anything that
Calamity
could go
Joe.
wrong, Calamity Joe, whatever we used to call him, there was always something happening to Watson, unfortunately. And I had to just keep calling you my entire life. I mean, you were my speed dial.
I think so. There were a few things. One is so like I said, I've always the thing of taking ownership. So when it's my patient, I feel a sense of a very heightened sense of responsibility towards them. That was one. Two is I think at that time, and now it's changing thankfully, but at that time there weren't very many 24/7 emergency clinics.
They aren't right now in many states also.
No, but yes, but in Bombay at least we do have a few. So at least, so my fear is that if this is an emergency, who does the pet parent turn to?
Yeah.
And so I was always brought up with this, do unto others as you would have others do unto you. So I always put myself in the client's position. If my son was sick or my animal is sick and I don't know what to do and you're desperate, then so that's why I was available. That being said, I wouldn't change anything, and I still give people my number, even though I've been advised not to.
I'm sure you are.
But the reason I do it is that I know how frustrating it is not to be able to. And yes, sometimes there are things where, say for example, the dog has ingested chocolate or grapes and it's 12 in the night.
Yeah.
By the time you are able to contact your vet at 9 in the morning, things could have gone wrong.
Yeah.
And something where you could have just induced a vomit early on or done whatever. So I do it because I'm a paranoid person in general, but I wouldn't say it hasn't taken a toll. The constantly being available, and it's almost become a compulsion. Like now, even sitting chatting with you, the fact that my phone is in the other room, that's one. Two is, the broken sleep is not easy either, you know. So now what I do is I periodically check my WhatsApps, and if I have a patient who I know is sick, then I make sure that my phone is loud and next to me at night, so that if they call, I'm available.
And I think maybe it's also because you did trust us as pet parents, and you knew that.
No, but I gave everybody my number.
You gave everyone?
Everyone has my number.
Wow, dog.
I do trust you, and I know that you wouldn't abuse it. But I always tell people that I would rather have a client who's paranoid than a client who's negligent.
Fabulous.
So I'm okay to be, if you're going to call me at 2 on a Sunday afternoon and say, can we buy this chewy? I might be a little short with you. But I will still, like I said, I'd rather be able to preempt something from happening.
That's amazing, Doc, because I feel like a lot of times I feel pet parents find themselves in the space of not getting access to their vets, and I feel a lot of issues do come because of that.
No, it is, but now
it's scary,
so
right?
what at our practice, what we do is that the clinic number, the mobile phone, is diverted to one vet every week. So one of our vets.
Nice.
So if people call outside of clinic hours, then they they can reach someone.
So one vet will pick up the phone.
One vet will pick up the phone
Fantastic.
outside of clinic hours. And now, like I said, there are at least 3 or 4 hospitals that I can think of, clinics. Well, not hospitals, but 24/7
the
clinics
animals
that
can
are
be rushed.
yeah. So they can be rushed. There is one in Bandra, there's one in Andheri. So at least there are places that are open. So I'm not so stressed anymore. But earlier there was nothing and no one.
Yeah.
There were times when we've gone in and opened the clinic in
Yes.
the middle of the night or spent the night or whatever. But
You guys have spent the night at the clinic? Yeah. Must have quite a few times.
Yeah. We've all done it at some point in time.
Yeah.
But so it's I'm thankful now that there are places that people can turn to. But even they sometimes have to turn people away because you have 1 or 2 vets on duty. You've got how many emergencies can you deal with?
Yeah, because I feel this whole thing of not giving, like I think we discussed this, that not giving your number abroad, and there's a certain culture for vets, right?
Yeah.
But I feel the 24-hour services are
Probably
properly set up.
and you have enough of them. Whereas here, you
We are-
don't have that
we are
many. Given the number of animals there aren't enough 24/7 services. That being said, we tried, but you need a certain number of, it's not just you need because your vets, when they've worked a certain number of nights in a row, they need at least 2 days before they can to recover.
Yeah.
The same with your staff, and you need to have a certain number of vets, which is very difficult.
Yeah.
And not many people want to work nights, to be honest.
Yeah, but it's sad because the animals don't choose to get hurt in the day, right? That has always been my thing where I get that. I applaud. What you guys do is just something else altogether. But unfortunately, most of places are shut on weekends.
Yeah.
On holidays, this, that. What do people do? Bombay, you're still sorted.
Bombay, we are.
You
And
are
Bombay,
pretty
like
sorted.
even with
There are
us,
enough
we
people
have 2
everywhere.
clinics that are open half day. Like our clinics, we have 4 branches, 2 of which are open on Sundays at least half day.
Yeah,
People are accessible.
and there's a way of doing stuff. But the other cities, what happens to those poor animals?
But no,
it's just sad, and we have to find better solutions to these things. Because on one hand, you want responsible dog parents. Where are they supposed to go? At the end of the day.
You need to have enough. But then, because I know that if, for example, before we became Happy Tales, when it was just Doc and me and
Dr.
we
Karkari's
never,
clinic.
Dr. Karkari. We if there was, we worked on every Sunday practically because there's invariably someone or the other who's sick. So we'd be in on a
But I
Sunday.
remember you guys used to be open for a couple of hours on Sundays.
But
Emergencies.
Emergencies. But that also, that means
Takes a
that
toll.
that you as a vet, you don't have any downtime. It's hard. You have no downtime. You have
100%.
no work-life balance then really. And
Yeah.
like at least, I think now that's one thing that the
Clinic is
the newer, the younger vets these days, it's all about like
Balancing it out.
work-life balance.
Yeah.
We didn't have.
You
There
guys
was no
didn't have-
balance.
No, I remember.
No, we didn't have a balance. So I understand why people don't give out their number, but me personally, I wouldn't be comfortable knowing that there was somebody who needed to reach me and couldn't.
Yeah.
Thank
Thank God for you, Doc.
No,
No, really, thank God for you. Like, seriously, I don't know how I would have survived with Watsi, with all his health conditions if you didn't pick up my call. Do you find Mumbai has, the pet parents here are more involved,
think so.
hands-on than other cities?
think so.
Why do you think that's happening?
in Mumbai, we have a lot of single people or double income, no
Working.
kid people who have chosen to have animals. So these pets are their children. So
Yeah.
they put in the same amount of, they invest the same amount of time and energy and money into
their
their
dogs.
into their dog or their cat as they would
With a child.
with
That's
a child.
amazing.
And also,
Yeah.
I think, life in Bombay can get sometimes, especially if you're living alone or living away from family, it can get lonely. So this animal is their everything.
Yeah.
So and
we're
now,
like the New York of India,
Yes,
right?
yes,
It's that
yes,
same
I think
culture,
so.
I think. Bombay's
I think
got that
so.
same culture with
I think so.
animals.
So I find that a lot of people nowadays, they don't hesitate to to run tests or to do whatever is necessary.
For
Like they
them.
don't think twice because this is that animals are their family.
Yeah.
And now people are a lot more
Clued in?
a lot more clued in. They're a lot more. They do their research. They are.
Good.
I'm happy. I'm happy.
Are you okay with people asking you 1,000? I know you are. 1,000 questions.
I'm okay with it because, like I said, I would rather have someone who's paranoid than someone who's negligent. And I think that there's no shame sometimes, and I do it. in me saying, I don't know the answer, but I will check and get back
But
to
you
you.
remember Watsy's head tremors? We figured
Yes,
out.
we figured it out together.
Yeah, you know, like
so I tell people I will check, and I don't. That's one thing. I feel like there's no shame in saying I'm not a know-it-all. I can't be one, and I don't want to be one. So I tell people, look, I'll get back to you, or we'll figure this out together.
Yeah.
And the other thing is now, thankfully, in certain fields we do have specialists.
Yeah.
So I also think there's no shame in referring your client. You're not going to lose a client if you refer them to somebody else. In fact, they probably appreciate you for doing so. So you're still the primary vet.
Yeah.
But if your dog needs a specialist consult, get them that.
Yeah.
You know,
for sure. You've always done that. I remember Watsy had an eye doctor.
Yeah.
And he went
So I'm very I don't want to be a jack of all trades. I'm happy being their primary physician, and then should they need anything more, I'll tell you where to go, and I'll be with you till the end.
Yeah. Do you feel it's important to incorporate mental health support for people working with animals?
I think undoubtedly.
Is that happening in Bombay?
So I think it's not happening in a very
on an organization
level.
Yeah.
But I don't know if you know, like for example, there's a huge movement online. It's called NOMV, Not One More Vet, because the suicide rate among veterinarians is much higher than in other professions. One is and I, for myself too, emotionally the profession can take a huge toll on you.
Yeah.
You very often suffer from compassion fatigue. You very often have no work-life balance. And then what really added fuel to fire was social media. Because what happens with WhatsApp and social media is things get blown out of proportion, lies get disseminated so quickly.
Yeah.
You don't even have time to defend yourself. There are people trolling you. I mean, you know what it's like. It's just hell. And especially in the West, this can happen. You can get sued.
Yeah.
And in the West, again, the student loans are insane. I remember I think it was 2010, when I met some vet students who were graduating. Most of them were in debt to the tune of $150,000 to $250,000 US when they graduated vet school. And then when you have people who are just maligning you online
all the time,
or it can take us. So even with us, sometimes if you're accused of being mercenary or doing something for the money, or not caring, or not being available even though you're trying so hard, it can really take a toll on you. Or sometimes just when you've, like, especially with me, there are households where because I've been at the same clinic now for literally 22 years, you've seen generations of pets.
Yeah.
So you're close not just to the pet, but you're close to the clients, the family.
Yeah.
So then when you lose a patient or you have to euthanize them, not that you're being blamed, you still, sometimes it can be heartbreaking.
Yeah.
So at least here at the clinic, what we try to do is I tell them, look, you can always talk to us.
Yeah.
There's no shame in talking to the senior veterinarian, saying, look, I'm having difficulty with this case, or this is a difficult client and I'm unsure of what to do, or I'm nervous, or I'm scared, or I'm upset, or I can't do this euthanasia by myself. I need you to be there. We're there for each other. We talk about it. And we've also been open about some of us, like I went to a therapist a couple of years last year. Some of my colleagues have as well. I've had one or two colleagues who are planning on taking sabbaticals because it got too much for them
emotionally.
Emotionally, it's okay. It can take it is very exhausting, and
fair enough.
And it's not just with us. So I know that Raj also, she was doing something just for animal caregivers in general. So not just veterinarians, but the boys behaviorists, or even people or the pet parents themselves. When you're nursing a dog, like you did with Watsy, the last 1 or 2 years was very hard. So when you have to go through that whole phase, when they're aging or when they're incapacitated, and you have to be their carer 24/7.
Yeah, it takes a toll.
And especially when it's an animal, people who don't have animals of their own or haven't experienced it may not understand what you're going through.
No, that's the other thing you tackle, So it's not just that you're tackling the animals and your own emotions. You're kind of navigating how people are judging you for how much you are putting in
So
for
either
an
you're,
animal.
and you know what, no matter what you do, you're either
Yeah.
doing too much
Yeah,
or you're
you're
doing
too-
too little,
Yeah.
or you're
You do
either,
you.
Yeah.
You do
And as a
you.
vet, you're accused of, you're running unnecessary tests,
Tests,
or
yeah.
you've not suggested this, or you.
Yeah, it's always tough,
so
right?
it's a very fine line, and you're
So
always.
do the boys get help also? What about the animal handlers?
I think it's more if they approach us. I don't know. I don't think any. Personally, I don't think they've needed it too much, because I think in the clinic, especially because here in India, we don't have vet techs or vet nurses like you have abroad.
Yeah.
So what they're doing is the handling.
Yeah.
But the brunt of everything comes on the vet,
Vets,
whether
yeah.
it's the emotional aspect or the having to talk to
I
the
think maybe this
clients
is in the
or
private
deal
clinics.
with them.
Yeah, yeah.
This is the way it is. So it's more us being, so we're like the buffer. They're not really, yes, they may have to handle a fractious dog or an irritable client or whatever,
Yeah.
but we're always there.
Yeah,
Whereas in the, in the West,
Welf.
for example, not Welf, I don't know, but
Yeah.
it's the vet nurses and the vet techs who do most of the stuff. The doctor will come in and do the consult and leave.
Yeah.
But it's the vet tech or the vet nurse who will draw the blood, who will explain stuff to the client
So
and
they take the
discharge.
toll.
And so that takes a toll on them.
Yeah.
Whereas here, all that stuff is being done by us, whether
Yeah.
it's the injecting or the prepping or the whatever it is.
Yeah,
so,
yeah. But I think that's happening in the
private clinics.
In the welfares is different. The
Possibly.
boys are doing a
we're
lot
doing
of
a lot
work.
of this
Yeah.
stuff. So here, who end up needing support are our poor reception staff.
That's across board.
Oh my Lord. I feel,
but doc, let me just, having been on the other side of the phone many times, okay, like I feel some of them now, suppose something's happened to my dog and I'm panicking and I get this cold response from the other side. Obviously, I mean, I'm not going to shout at her. I'm just going to be firm
maybe
with
you
her.
didn't, but there are
You know?
some who shout, who are abusive, who don't understand,
Yeah,
and then, or there are some who insist. Now, yes, if it is an emergency, by all means, please come immediately. But if you want to trim your dog's nails and you're only free between 6 and 7 on a Saturday evening, that is not cool. It
And
is
you're not a groomer.
You're not, exactly.
I mean, this is something we spoke about, right? Vets are not groomers.
No, but yes.
So many dogs do this, and parents
So
do this.
nail clipping still, I will do it. But,
Yeah,
but I do feel sorry for them, because they're doing the best they can.
Yes.
And see, it's not like it is. So here we have we give out a certain number of appointments. Then you have people who are walking in. Then you
Yeah.
have people who are calling. Then you have people. Then they're doing billing. I do feel terrible for
Yeah,
them.
they
I do.
really, you need
so
to or three.
they
I've
have.
seen they've increased.
They've had,
Behind that.
and even that's not enough.
Yeah.
And we've had them all in tears at various
Yeah,
times.
yeah.
So they need help. So there we talk to them. We're there for them.
Yeah.
I've spoken, but because they really can get. And I've seen people who are saccharine sweet.
What was
with
the one's name? I remember when first time I called. Severina. Was she the one when 2010? Who was that one?
Severina, probably. She's
When I
no
gave
longer here with
Watson's
us.
name, I was like, Dr. Watson. She said, what? Your dog's name is Doctor? So I said, yes. No. They're like, yes. No.
It was Severina.
No. She's so cute.
No, we try. We tell them, how to handle it. So someone says, is it an emergency, or if they want to speak to a vet at that moment. So most of the time, what they do is they
You're
take your
busy.
number down
Yeah.
and we call them back.
Yeah.
But if they insist on speaking to the vet, then you ask them, what's happening? What can we do? Have you spoken to them before? Can you
Yeah.
tell us what's happening? And now thanks to WhatsApp, at least they can send us
That's
pictures.
better.
They can, But I know it's not easy and for the client, but it's also really hard on these poor staff.
Not
But
so
that's
often.
also why I give people my number. So look, if it's really difficult and you've not been able to reach me through the
Yeah.
reception, you can send me a message, and I do get
and
back.
you check your phone. Yeah.
And I will check my phone.
What is the most challenging part of your job?
For me, trying to sort of emotionally detach myself, especially when I've been with clients through it all, to sometimes not to think purely from a clinical perspective.
Yeah.
Because here very often in my head, but I think that is my problem. I don't know whether it's a veterinarian's problem, is I know that the husband lost his job 6 months ago, and I'm
Yeah.
wondering if they're going to be able to afford these tests or this particular diet food.
Yeah.
Or I know they're having a hard time already, and now if I have to, give them bad news. Or so for me, I think that is a little
Navigating
tricky.
that.
Navigating that is tricky for me, but that is my problem.
Yeah.
I don't think it's a veterinarian's problem. And then of course,
Like I said, you are the vet.
No.
You are really
No,
like that. You're
no.
considering all these things.
But I
It's
don't know.
amazing.
I don't know
Rob.
whether that makes me a better doctor. Maybe teeth makes me a better human being.
You are
But I
a great, I would not, I don't know what to say, but you are my go-to
No,
doctor.
but listen,
you know?
now I'm getting embarrassed. I'm not good with this. Let me
No.
just move on to something else. I don't want
No,
that.
it's very
no,
good.
but I'm just trying to say that this is so this for me is hard to sort of detach and view
Yeah.
them purely from a clinical point of view, and then sort of take the way forward. Advise
Yeah.
the way forward. Sometimes that is my issue, and it is also sometimes I find it is tricky also to sort of tailor your recommendations sometimes also to suit their budget, because what
Yes.
they can afford is also
Yeah.
you have to factor that in
Yeah.
to what you recommend.
Yeah.
So then I try and do stuff. You recommend
Yeah.
something generic rather
Yeah.
than something that's patented, or you try
Yeah.
and work your way around
But
that.
do you give them both options saying this is what's needed?
I always do that. So I will say this is what I would say ideally. This is what I would say is absolutely essential. So this is
Yeah.
almost like non-negotiable. This has to be done. I'm
Yeah.
sorry.
Yeah.
And then this is now the way forward. We have these options. This is cheaper. This is more expensive. This is more effective.
Yeah.
I try to lay it all out there. I try to give them estimates also so that
Yeah.
they know what they're in for.
Yeah.
And if they can't afford it, then I try and work my way around that as well, where I have some really lovely clients who've sponsored, or we have.
Oh, how wonderful.
Yeah. So we have a few who step in then sometimes, who say, look, if you feel that somebody deserving who really the
Needs.
dog or cat really needs something and they just can't afford it,
Yeah.
let us know. So I have a few like that who I've turned to. And then we also have it's called the Happy Tales Foundation. So we
Yeah.
use it at our discretion. There's this family of homeless people who live near Madhu Park somewhere, and they have this puppy. So they brought the puppy in. So we've vaccinated the puppy,
Yeah.
and we've given
But
them
the fact
food.
that they brought the
and-
puppy
exactly.
you have to inspire,
Exactly.
right?
So then,
that's amazing.
Then there's no question of them going.
You know, if someone doesn't have a home but is bringing their puppy to a vet is commendable.
Exactly. So then you want to do whatever you can.
100%.
Yeah.
You know,
Yeah.
with or without foundation.
Absolutely.
You know what I mean?
There would have been no question
Yeah,
anyway.
like that's so
that
inspiring.
is, yeah.
And the flip
Yeah.
side is very important to discuss because, like we were talking about responsible pet parenting, Doc. When you get a dog, research, speak to your vets, ask questions.
Yeah.
No,
and
be regular with
you
the
have to
health
be
checkups.
exactly. So I don't think so. But it's not just for animals.
So
I know that my mother also, she thinks about how much money she's going to spend going for her annual health check rather
Yeah.
than the fact that
She needs it.
You need it.
Yeah.
And it preemptively, if you
Yeah.
diagnose something,
Yeah.
it's so much better.
Yeah.
But so you have to not think of it as a waste of money.
Yeah.
I think annual health exams, especially after the age of 5, are very important.
Are we talking about humans or dogs right now?
No, dogs.
Okay.
Dogs and cats. Dogs and cats after the age of 5.
Yeah.
And vaccinations, because in India especially, like
Yeah.
he would need a senior check.
Yeah, he's a senior fellow.
Vaccinations, because diseases like distemper, parvovirus, leptospirosis, these are endemic in our country.
Zoonotic, no?
Exactly,
Yeah.
zoonotic, very much present. So you can't be lax about them.
Yeah. And I don't think a lot of pet parents even know about the 9-in-1 vaccine. The more and more I've been getting into this, I'm realizing
but
lot
I
of pet
feel in Bombay they do.
Bombay, you're good. I think Bombay, you're very sorted.
Yeah.
In other states, I know vets are struggling,
To vaccinate,
to get pet families to just vaccinate their dogs.
Correct.
Forget anything else.
So that deworming, and then even tick and flea control.
Yes.
So you need to, because the same way we get dengue and malaria and chikungunya from mosquitoes, they get a whole host of diseases that they can get from ticks.
Yeah.
Cats can get a whole host of diseases from fleas. Fleas transmit tapeworm to both cats and dogs.
Yeah.
So that is something now that, yes, I understand you don't want to use something, you're hesitant because you feel like insecticides are toxic, etc.
Yeah.
But the flip side to that is if you're going to have multi-organ dysfunction because of tick fever, and it was very, very preventable.
Yeah.
Then
why not?
Yeah. So talk to all I'm saying is talk to the doctor.
That's what even I was
If
saying.
you don't want to do a tablet, do a spot on.
Yeah.
If you don't want to do a spot on, do a collar. There are options. And
Do
now we
collars work?
have. It's better than not doing anything at all, is what I say.
It's like I remember those collars.
No, but there are some now that are quite effective.
I'm sure they're better now.
Spot-ons are so I find that collars and spot-ons work decently as preventives. If the dog already has an infestation, I don't know if it's going to work. Then you might need. But then again, you probably need a blood test before you talk to your doctor. Find out if they feel like it's. And then okay, if you can't, so if it's a community dog, then you weigh the pros and cons. And if you can't take the dog in for a blood test, but you know that the ticks are going to, he's a high chance of getting tick fever. They're breeding everywhere. Then you talk to the doctor.
But you have to. It's very important, Do private vets encourage spay and neuter?
We definitely talk about it. We don't encourage indiscriminate breeding for sure. But yes, we do. So we speak about spay neuters. But now, so like I was telling you earlier, there is an article which was a retrospective study that was published where they now this is not for indies. This is for pedigree dogs, certain breeds. So they issued breed-specific, gender-specific recommendations based on the incidence of arthritis, hormone issues, cancers and infections that occurred at various ages and stages depending on when the dog was neutered. So was the dog neutered at 6 months before their heat? Were they neutered at 11 months? Were they neutered after age 2 or were they not neutered at all?
Yeah.
And then, for example, they found that in certain large breed dogs, if you neuter too young, then the incidence of arthritis is so much.
Yeah.
In certain, so I give people that recommendation and I always send them the entire article so that they can read it for themselves. But as far as indies go on the streets, I think it's better to neuter because to have litters of unwanted puppies, dying of parvo or distemper or being run over
But I can't breeds dog. I mean, if someone now, say someone has a lab and they want to, a recent conversation we both were just in, let her have one
so
litter,
I always tell them,
where are those puppies going to go, dog? Even if it's a breed dog.
So in this particular person's case, they probably would find homes. But my point is, one is I always tell people, you're not doing your dog any favors.
Yeah,
it takes a huge toll on them.
Yes.
At the end of it, they really they're unrecognizable, most of them others.
Yeah.
Secondly, you're giving them, especially when they talk about mating their male dogs, instead you're giving them a taste of something that's very hard to repeat. Where are they going to have males outnumber females 10 to 1. Most people don't want to mate their females, and rightly so. So what are you doing? And thirdly, you have to think, and then if you are intending to breed your dog, you have to, one is figure out if you're going to have appropriate homes for the puppies, but two is you need to screen your dog and check with your vet if your dog is a carrier or for any diseases or conditions that the puppies may inherit. So for example, if your dog is a monocote, has only one testicle that's descended, you should not mate your dog. If your dog has dysplasia, you shouldn't mate your dog. If your dog has an aggressive temperament, you shouldn't mate your dog. If your dog has atopy, and the incidence of atopy is very high in Bombay. So atopy means they have very sensitive immune systems and they overreact to environmental allergens. So if it's dusty, if the weather changes, if they go. And Shih Tzus, Beagles, these are all breeds that are prone to atopy. So you don't just blindly breed your dog. You have to ask the doctor what they think about it.
Yeah.
And even if it's a retriever who doesn't appear to have any lameness issues, if you're intending to breed the dog, you get a hip x-ray done beforehand. So you know if they have even like a low-grade hip dysplasia because you don't want to put anybody else through that.
Yeah. I remember once when I'd come to the clinic, there was a tiny puppy and some kid had stepped on it.
Yeah.
I don't know if you remember that.
I don't remember that because that's happened far too often for my liking.
I remember and I was just like, you have to, that's why I brought up the kid thing, saying, so when trainers and behaviorists recommend to people, they say the child should be 8+ before a dog comes in, because a child should be able to manage his own body
and our rule is that if a child is under 12, your child is not allowed to pick up the puppy. So I tell people, if your child is under 12, they sit on the floor and they play with the dog, but no picking up the puppy.
Yeah, because
they drop them, they're wriggly, they're teething, and it just takes one. So we had quite a few puppy fractures during the pandemic because the people adopted puppies and the children were home with the dog, and then the dog, even the puppy falls awkwardly from this height, they can break a leg. So I'm very firm about that.
Yeah, it's very important. I remember once I had brought Watsy to the clinic and there was a Cocker Spaniel, his color actually, and a family had come to euthanize because there was some health issue. And I remember the whole clinic had just kind of come together to, comfort that family and help that family. So how do you all navigate pet loss?
So First of all, if it is my own patient, what I do is, if I feel like the dog or cat is suffering or it's nearing the end, I tend to I have that discussion with them.
Yeah.
So I talk to them about whether they feel they would be open to euthanasia if there's nothing more we can do medically to alleviate their pain. Because my point is that your dog or cat should have some quality of life. It's not just, oh, they're still eating or they still recognize me. Do you want to wait to get to the point where they're not, or they're they're having seizures, or they're throwing up continually? I don't want that. I don't want them gasping for breath. So I talk to them about quality of life. And now what's helpful, I don't know if it was there earlier, but now I'm more aware of it. You have quality of life surveys and questionnaires online.
Oh,
so
nice.
I suggest that the families sit together and take the survey together, because I personally, I will not euthanize a patient as far as possible unless the whole family is on board with it. So it's not just that, okay, the parents have made the decision, but the children are absolutely haven't come to terms with it.
But the dog?
No. So I don't give them an indefinite amount of time. But I don't want it to be a spur of the moment decision either. Unless they, to me, seem like they are emotionally mature people, I don't want it to be a spontaneous decision. I want them, if not sleep over it, at least take a couple of hours to discuss it. Because I have seen, and Dr. Karkare also has seen, because we've been around for so long, families that have been literally torn apart by the guilt or the resentment. Somebody's made a decision and the other one, they didn't wait for somebody to get into town, or somebody felt that the decision was made too prematurely, it was too rushed. So I'm very particular about that now. And I always try and talk them through it. And I always try to tell them, look, that there's a reason it's called euthanasia, because it's an act of mercy. It's a merciful death. And I feel like with euthanasia, at least, so I have lost most of my animals, actually. I didn't have to euthanize them. But with my cat recently, I had to euthanize him. And so I know how it feels both ways. Now with Paddington, he was sick.
He just went, right? I remember Paddington.
But he had been ill for a while. Now that was difficult. I wish I had done a quality of life survey. So he had a mass that had grown. It was inoperable. It was in his middle ear. And it had affected his breathing, basically. And but he was still eating. He was still happy to go for a walk. But there was that constant fear of respiratory distress, much like what happened with Watsi. And I remember I took him to the clinic once, and at that time we were 9 girls working in the clinic, including myself, 9 vets. And they were equally divided, except for myself. There were 4 who said, no, we think, it's time. 4 said they didn't. I took him back home. That was it. But he ate till the very end. He stole a biscuit half an hour before he died. So it's very hard. So I wish I had done that quality of life, but I know that last few months
living
with
online dog, I think it's a very important survey for everyone to have.
But I think that last 3 or 4 months where his breathing was constantly sort of labored and audible, I don't think I slept. And it was like living with the sword of Damocles over my head. If I didn't hear the breathing, I thought he was dead. If I heard the breathing, I couldn't sleep. It was
exactly how you feel.
Hot, yes. So and then he, like Watsi, he also has bloated up. And then it was terrible. It really took a toll on me. So that was hard. But with my cat recently, he had some ongoing health issues. But at the end, I had to make a decision to euthanize him very quickly. I didn't really have time. He was in a lot of pain. He had blood clot lodged in his aorta, in his abdominal aorta. So he had lost
the legs
sensation, waist down, but more than that, he was in pain. And if you wait too long, then necrosis can set in, and it's very bad. And he was yowling in agony. And Danish, luckily it was Eid, so it was a holiday. So Danish came. My son was home, and we came in, and my son was devastated. So personally, when you're saying navigate pet loss, he's seen this cat from the time he came home from the hospital. He came home on day 4.
Must have been so hard.
And this cat was like his brother. He went through, I literally saw my son, and that's why I talk about how hard it is for children, go through all the stages of grief. From the anger to the...
10, he's 10.
he was mad. When he was angry, he was most angry at God. How
Yeah.
could he do this? How could he
Yeah.
let him suffer? How could this happen? You're a doctor. This is not supposed to happen. Isn't there anything you can do? Is there
Yeah.
anything? And it broke my heart. And that
Yeah.
cat left a void. For a long time, and even now, sometimes he wears his collar on his wrist.
Oh, so
Like a
sweet.
band. He misses him. That cat was he
Everything
was
to him,
everything.
huh?
He
Yeah.
was, if he was doing his homework, he'd be
Yeah.
there. If he woke up in the morning, he'd come and sit with him.
Yeah,
If
yeah,
he'd
they
come
just
home from
become a part of you.
It's just
Not even part of the family. They're part of you.
and that cat was more dog than Paddington was sometimes. When my son was young, if I was nursing him or if I was walking with him, they'd be walking. Both the cats would be marching up and down with me.
So
It's just,
sweet.
it was so sweet. So I know from both ends. So like I said, I always ensure that people are convinced that they're making the right decision
Yeah.
for their animal.
Yeah.
I think it's very important. I also talk to them about speaking if they need to a therapist.
Yeah.
And I also tell people, so a lot of people feel very guilty when they made that decision,
Yes,
because they feel like
100%.
deep down, did they do it because it was taking such a huge toll on them or
Yeah.
whatever? And see, as somebody who has been a caregiver for a sick animal, and I've seen with people also, like when my grandmom was sick or whatever, sometimes when they pass, it can also be a bit of a relief, because
Yeah.
it's like you've been holding your breath for so long.
Yeah, yeah.
So there's that guilt, and it's automatic. But I try to talk them through it, because
Yeah.
it's very important.
What stage do you start doing this? Do you think if parents were guided up top earlier, it's easier, or it's just never easy to process this information? Or
So I feel
one
like
day you
if
have to let them go,
if
right?
they've been diagnosed with a condition which is where they're not going to recover from it,
Yeah.
then I just use my judgment. I feel like at
Okay.
some point I start to have that discussion, and I tell them, look, it's not time yet,
Yeah.
but I want you all to at least start talking about it, because there are some people who their religious beliefs, for example, would just don't permit them to make this decision. So then if
yeah.
that is the case, then
Yeah.
I try to get them to change their beliefs.
Yeah.
If I feel like the dog or cat is really suffering, then so I also try to tell them, look, because we also have this other notion where, okay, we sort of take them home to die. What if we stop treatment? And that is actually more cruel, because sometimes the treatment is all there is between, to stopping them from being in unbearable pain or unbearable distress.
yeah.
So like with kidney disease, for example, if they've reached a point where the blood urea nitrogen is very, very high, if you don't treat, they're going to have tremendous nausea, they're going to have seizures, it's cruel to not treat. So
Yeah.
I tell them, look, it comes to a point where you either treat or you euthanize, but taking them, not treating them is
And keeping them, it's horrible.
actually more cruel.
Yeah,
You
that's
know?
horrible. Yeah, but I guess there's so much human emotion to navigate. So what I was saying was, Doc, like even as a pet parent, when they come for happy visits, or perhaps, this is from my experience, right? I've always knew, even though I used to keep researching and telling you, oh, Doc, there's a bulldog that's
Correct.
18 years old here, and
Correct.
you look at me and I'm like, Doc, he's 8 now, he's 9 now.
Yeah.
I started panicking
I know.
from 7 plus,
Yeah.
I think.
Yeah.
That when is he about to go? Because online it says 8 to 10 years,
Yeah.
right?
Yeah.
And what's he crossed 10?
Yeah.
He was 10 and a half. But I feel like, on one hand, I feel you're never prepared. No matter how prepared you are, you're never prepared. On the other hand, I feel talking needs to start because of the amount of senior dogs I'm seeing being abandoned because of health conditions. There's a lot of that happening. Again, I'm guessing you don't have that client.
No, I don't have that
But it
clientele,
is
thank
happening,
God.
Doc.
Yeah.
You don't want to pay the vet bills because the dog's getting sick.
That is true.
Dogs go through Benjamin Button, right? It's that whole process.
What I do though is when people are when I see people adopt or buy a number of animals in a short period of time, that's when I warn them, because I say, look, yes, it's great. You now have 4 dogs who are under the age of 2. But remember that 10 years from now, you're going to have 4 aging dogs.
Yes.
So you're going to have to deal with all their health issues. And
Together.
if you can say you're able to deal with, with the financial aspect of it or whatever,
Emotional.
you have to deal with losing them also.
Yeah.
So I try to warn people. With one family, it didn't go down very well. They switched vets when I told them, because what happened was they had the male, they had the female, they had another dog, and then they wanted to keep a puppy, and they were all under the age of 3. And I had seen how a few years before that, when they had lost their first dog,
Yeah.
they were devastated.
Yeah.
And I said, a few years from now, they're all going to age together. I don't know if this is a wise decision for you to keep the puppy, because they had a really good home for the pup and they were very offended.
Yeah.
But I still think I would still give that same advice, because you have to think about the future.
100%. You have to.
Yeah. And also when I am actually doing the euthanasia, if it is a dog or a cat where, we think we're going to be able to get the vein easily, or they have a catheter and they're sort of easy to handle, then we even sometimes go home.
Yeah.
But otherwise, I try to do it in the clinic in a room where they have a little bit of privacy.
Yes.
And I usually insist that at least one family member stay with them till the end, so that their last few moments, they have someone around.
Do pet parents not want to be inside?
There are some who are like, well, I wouldn't say like ostriches, but they can't bear to face it. But most of them, after I chat with them and I say, look, he or she just knows that they're in the clinic. They don't know what's going to happen next. So if you could just be strong for them for these last few minutes, and so that they fall asleep in your arms or with their head on your lap or their head on your arm, I think it makes a difference.
100%. Doc.
So I usually insist on it.
So, Doc, what do you think? What are your thoughts on alternative healing for animals?
I'm very open to it, especially to like homeopathy or acupuncture, or now people are talking about the flower remedies, the Bach flower remedies. I just tell people that, look, whatever you're doing, try and do it. First of all, ask your vet about what they think, and do it in conjunction with their treatment.
Yes.
I'm not one of those all or nothing people. So I'm okay if you pursue my treatment and homeopathy simultaneously. I recommend acupuncture for as part of physiotherapy for dogs who have back issues or spine issues or whatever. And I do feel like it helps. So I'm very open to it.
Nice.
But I just want people to use it as complementary treatment rather than exclusive treatment. Especially if it's you need to strike a balance.
Yeah. And do you work in tandem with canine nutritionists, behaviorists,
So behaviorists
trainers?
we work with a lot. So a lot of the behaviorists are my clients, and then they send me patients. So and if I have a dog or cat come into me where I feel they could benefit from a behaviorist intervention, then I recommend a behaviorist always. So that is one. Nutritionist wise, it's a little trickier. So yes, if they are very keen on following it, like sticking to, for example, a home food diet, then I will advise them about maybe who they could consult, or we work with them and tell them what we need. Because, for example, while there are some food items which are not toxic or contain certain nutrients that are beneficial to them, as they get older, those same nutrients may not be good for them in certain ways. So like organ meat is high phosphorus, may not be good for their kidneys. So things like that. So we talk them through it. Unfortunately, in India, you don't have the way you have in the US or in the West. You have board certified veterinary nutritionists. You have veterinarians who have done a 3-year residency program in nutrition. Those are nutritionists.
Do we have any of those
in India?
here?
You have nutrition, but unfortunately, in India, the focus, because we're mainly an agricultural country, the focus is on large animal nutrition, farm animal nutrition. And of course, I went to college 20 years ago, but there was not enough focus put on small animal nutrition. Of course, they thought of cats as small dogs, and they thought of dogs as babies. So I remember we were told by some people, oh, you can't give them chicken, it's too heaty until they're 6 months old, and giving them. Today I had someone bring in a Shih Tzu puppy who's been on Cerelac. So.
It's all over the place. So canine nutrition, I mean, you remember when we launched Parivaakya, Kat Ferreira was there.
Correct.
She was the first nutritionist I met. I didn't even know it existed.
Correct.
So, but since then, I think
there are quite a few, but like I said, unfortunately, there aren't enough veterinary nutritionists. There are quite a few nutritionists.
So vets kind of have to do this on their own?
No, they could yes. So if they go abroad and specialize in nutrition, yes, so they do a diploma, or I'm hoping that more young vets who are, or veterinary students now choose to pursue their master's degree in nutrition, but with their thesis focusing on small animal nutrition. I think we need more of that.
We need more of that,
because
sure.
So in India, we don't offer a lot of subjects for specialization, but nutrition is offered. It's just that
Nobody
I don't
takes
think
it up.
there are not enough potential small animal vets are taking it up. I think it's more the ones who are maybe joining the large animal industry.
That's what's happening, huh?
The dairy industry or whatever it is.
Top 3 signs that an animal needs to see a vet immediately.
breathing differently, excessive thirst, excessive urination, pale gums. You said top 3.
But that's okay.
Also if their posture and their gait is different. So if they're standing arched or tucked up, or they're not, frankly, if they don't seem themselves,
go to the vet.
Yes, please don't wait.
Okay. How can non-pet parents contribute to animal welfare in their community?
So they can. So even if they're non-pet parents, there are plenty of feeders who are in the area who are looking for. It's expensive to feed cats and dogs, and believe me, when you start feeding community animals, more and more just turn up.
Yeah.
But I was coming through Baroda Road last night. It was close to midnight. The number of cats who were out on the street were not funny, and that's because the feeders feed them at that time.
Lots, huh?
So there are some who could do with sponsorship. Find out if the dogs and cats in your area are neutered. If they aren't, find out who's looking after them. Get them neutered. Yeah. There are plenty of organizations and people who could do with donations, contributions, things like that. And even if you don't have a pet, try and inculcate certain values in your kids, for example. You know, compassion, awareness of animals, awareness of, if you burst crackers, your community dog is going to be running helter-skelter. But that being said, I feel like today's kids are more conscious and clued in. My son is very, and he's done it with his friends. So now the colony kids, Diwali, there are no crackers.
Oh, fabulous. Yeah. We really need that across India. How often should pets get checkups?
I would say maybe definitely annual checkups when they come in for their shots, and otherwise maybe every 6 months or so. When they're older, definitely every 6 months for sure. And then if during those checks, if anything is amiss, so if the vet hears a murmur, then they'll tell you, look, these are the signs to watch for. Or if they feel like they've got early onset kidney disease or their arthritis is acting up, then more. Yeah. And then depending on the condition, we tell them what sort of follow-ups they're going to need.
Got it. What's the biggest mistake people make when caring for their pets?
Don't treat them like as if they're human beings, so as their children. So if you want to medicate your dog or your cat, call up and find out if it's okay, if it's appropriate. So for example, a single dose of Crocin can kill a cat.
Yeah, I believe so. I've heard that.
Grapes are very toxic to dogs. So you don't treat them. Always just keep in mind that though you love them, they're your children. Yeah. It's a different species. So what you're doing should be appropriate for them. Don't shave them in the summer. You're not doing them any favors. Yeah. Their coat acts like a buffer. It protects them from the heat. So I think it's called anthropomorphism, where you're projecting human
stuff
onto them.
And even that whole thing, I let my dog have 1 liter and...
Yes, exactly. You're not, fulfilling some innate biological urge where she's going to miss it.
The other thing I've noticed, Doc, people say I sterilize the female, but I will not sterilize the male.
That is an Indian thing.
That is I've seen that in my animal welfare.
So then what I do very often is, and especially if the man is, so how middle-aged men have prostate issues.
So Doc, now if you had to leave 3 tips for pet parents on what they could activate today with regards to the health of their dog, what would that be?
So talk to your vet about vaccination and deworming protocols, tick and flea control protocols. Don't shy away from doing annual wellness checks, because sometimes you can diagnose things early on or prevent things early on. So prevention is always better than cure. The same way we as human beings have lifestyle diseases, they do too. So while they look cute if they're all roly-poly, it's not good for their joints. They can still get fatty livers, they can get diabetes. So obese dogs have a shorter lifespan. Obese flat-faced dogs have more difficulty breathing. Yeah. So all the problems that we have, they have. So talk to your vet about an appropriate diet, an appropriate exercise sort of schedule for your dog. It's very important. It's a commitment, and it is not something you should take on lightly. Yeah. This is like, there was this, I think the RSPCA in England has this bumper sticker. It says a dog is for life, not just for Christmas. Yeah. You have to realize that. Yeah. It's a commitment, and yes, they bring joy, they add to the quality of your life. But it's a huge responsibility. So don't take it on till you're ready for it.
Yeah, for sure. That was a wonderful conversation. I'm so happy you took out time and you came and did this. And thank you for being you.
Thank you for having me.
You're always welcome.
Oh,
You're always
God.
my first phone call, remember? For everything. I think when I thought of this idea, I called you first.
You did. We met for dinner. That's when you chatted.
Yes,
with me.
yes. Thanks,
I'm
Doc.
so
Thanks
proud
for
of
being-
everything you've done.
Thank you,
Really.
Doc.
Thank you. Thank you for having me.
Yes. Watsy's I don't know if you noticed.
I noticed. Of course, I noticed.
That's, you know who that is, now your favorite patient.
Unmissable.
Watsy G. I hope you enjoyed this podcast. Doc had lots to share. If you have any questions, please leave it in the comments. Please like, share, and subscribe to this, and share it with people you feel it will be beneficial for. See you in the next episode.